Malaysia, reimagining medicine to help improve and extend lives of over 32 million Malaysians.
So, I was diagnosed with heart failure in 2021. It was a grueling tale, I think, from the time that I fell ill and was admitted to CCU, and after 6 long weeks of admission, I was finally discharged. After that, there was quite a long period for me to go back to work, but now I'm back to work. I'm already starting back on my training, and tomorrow is another day. I'm Yong Jun. I'm 36 years old. I'm working as a doctor, and at the same time, I'm studying for my specialty training now as well. So actually, in 2021, I was in my training, and I was transferred to Sabah to continue my training there. New place, new experience. Actually, was very excited to go over there. But when I arrived there, I think shortly after that, I started to develop quite severe shortness of breath. Whereby I had difficulty like walking from my car to the ward, and even between seeing patients, I had to sit down. I started having difficulties falling asleep. Not really falling asleep, as in every time I slept, I will wake up panting or having difficulty to breathe. But at the time, I attributed a lot to it to anxiety, new place. Maybe I'm just not comfortable in a new place. But as it got worse, actually, because we were also at the height of pandemic, I keep thinking I had COVID at that time. So, but after 2 weeks of trying to prove that I had COVID, and every time I was negative, I was very fortunate. A friend actually brought me to see another medical specialist, and he was the one who suggested I do a heart scan, an echocardiogram, and that was when we diagnosed and found out that I had heart failure. So actually, by that time was about 2 weeks after my symptoms had started. I was actually in quite bad shape. I had only 23% of my heart left. And I was immediately admitted into the CCU. My blood pressure was quite yo-yo. It was at times so low that they needed to pump in medication to make my blood pressure and heart rate go up. At the same time, my blood pressure was too high, so they needed to give me medication to bring it down. So the initial, I think, 1.5 weeks was quite difficult to control my blood pressure. And after spending 3 weeks there with treatments, the discussion had came up for me to fly back to Peninsula to get further treatment. And I flew back for another 3 more weeks in the hospital before finally being able to be discharged at that time.
What exactly happens in heart failure? What causes such severe shortness of breath? Professor Dr. Chee Kok Han, a consultant cardiologist, explains.
So essentially, the heart is it's like the engine of the body. So it's actually pump the blood from the heart, of course, to the brain, the muscle, the intestine, and all that. So essentially, it's like the engine. So it will actually, by pumping the blood to the brain, for example, it actually provide the nutrition, the oxygen to all these vital organs. Now, the problem that we are going to discuss today, of course, is heart failure. So what it actually means literally is that the engine has failed. The heart is actually not able to pump efficiently the blood to all these vital organs. So, for example, the muscle of our body, then this is where problem will start, right? First, the patient will feel very tired for obvious reason. We are not pumping enough oxygen to the brain. Then it will actually also cause problem to the kidney, and we will start seeing the patient having water retention. So you will start seeing patient complain, my legs is swelling up. My doctor's telling me there is actually water inside the lungs. So this is usually when we see the patient with heart failure. The usual symptom that we see is fatigue or tiredness that get water retention in the body, and they feel very breathless easily for a few reasons. Firstly, because of water retention in the lungs. Secondly, because now the heart is not pumping very well. The engine is not functioning very well. So this is usually how patients with heart failure will present to us.
What would cause the heart to sustain this kind of damage?
Yeah, so this is a very good question. In fact, heart failure is what we call the end game for a lot of heart disease. All right, whether you're looking at, for example, a young baby who is actually blue the moment they are birthed because they have something called congenital heart problem, or you actually have somebody who actually have heart attack before, or they actually have some virus infection of the heart affecting the heart muscle. So all these illnesses that actually affecting the heart, if they are not being treated properly, they will end up as heart failure. So heart failure to us is something like an end game for most, if not all, of the heart problem.
So this puts a significant proportion of our population at risk of heart failure.
So in Malaysia, in fact, in global, we can roughly divide the cause of the heart failure into two main groups. In fact, it's about half of each. One is definitely secondary to blockage, all right? If the patient actually have blockage and have multiple heart attack, whether it's a major or small heart attack, so of course this heart attack will damage the muscle. So these are the patients who are definitely high risk of getting heart failure. Then the other big chunk, or 50% of the other patients with heart failure, are usually due to unknown causes. Most commonly is due to the infection of the heart muscle, including the recent COVID outbreak, for example. All these will actually can and may damage the heart muscle. And logically, if the heart muscle is damaged, of course, the heart is not able to pump because the muscle has lost its function. So then these are the other main cause of the heart failure. So coming back to your question, who are at risk? Definitely those who actually have the three high, the high blood pressure, diabetes, and high cholesterol level. These are the patients most likely may actually have coronary artery disease or blockage in the blood vessel. So these are the people who are definitely higher risk of heart failure.
In Malaysia, coronary artery disease is what most people think of when it comes to conditions of the heart. Professor Chee emphasizes, however, that people need to understand heart failure is a separate condition that has its own symptoms, distinguishing it from coronary artery disease.
So sometimes when I speak to the patient, I tell them that, look, the heart is something like a car. All right, for example, so heart failure, that means your engine is not functioning. And coronary artery disease, or what we call the blockage of the blood vessel, is more like your petrol pipe is actually blocking and not supplying enough petrol to the engine. So it's a two different things. However, if the patient have blockage or coronary artery disease and actually have caused heart attack and some of the heart muscle have died, then subsequently the patient may actually develop heart failure. So in a way, you can say that coronary artery disease is a risk factor for getting heart failure, but they're two different things.
The prevalence of coronary artery disease in our country is increasing, but few people are aware that while surviving a heart attack is an ideal outcome, it doesn't close the book on their health problems.
So I have been in cardiology field for about 20 years. When I first started 20 years ago, half of my ward is actually due to coronary artery disease. They come in for heart attack. But now when I step into the ward, half of my ward nowadays is actually heart failure. Part of the reason is because although some of us are actually, some of the population actually well educated on the risk factor management, and when they come in for heart attack, we actually have proper medication and proper way to treat. So they actually survive the heart attack. But despite that, the heart muscle also being damaged. So that's the reason why nowadays we're actually seeing more heart failure nowadays.
So coronary artery disease is a silent condition where only markers like cholesterol levels can give a hint to the gunk building up in the arteries. Heart failure, on the other hand, has certain hallmark features, as Professor Chee had explained. And yet, diagnosis is often delayed in patients who don't realize that their symptoms are due to a heart problem.
Everyone, I think, at some point in time does feel fatigue and tiredness. And that is a problem for us because heart failure, unfortunately, their symptoms is actually very non-specific, and that actually lead to the delay of diagnosis or confirming that this is a heart failure. But if you feel fatigue, if you feel tired, and at the same time you start to see water retention, your leg is swelling up like as if, just like a pregnant mother, when you press on the leg, you actually have a depression on the leg. That means you definitely have water inside your body. Because, like I said, the heart is like an engine, so the both sides of the leg will definitely have swelling. And because of gravity, usually you will see swelling on the legs rather than on the arms. And this is usually when the patient will get worried, and this is usually when they start to seeing the doctors. And by doing some tests, then we will know that, okay, this patient definitely have what we call a heart failure.
And what kinds of tests would you do?
So usually once we see the patient who actually have water over or water retention, usually we'll think of three things: whether the kidney is functioning correct, whether the heart is functioning correct, or whether the liver is functioning correct. So we will usually do some blood tests and some scanning. So to confirm that this is actually a heart failure, usually we will need to do a blood test and also an ultrasound of the heart. The blood test is what we call a BNP test, or brain natriuretic peptide. This is actually what we call a biomarker for heart failure. If the blood test comes back as very, very raised, then this patient most likely have heart failure. Then the other test we definitely will do is what we call echocardiography. Essentially what it means is that just an ultrasound of the heart to see how good or how not good the heart is pumping. Usually we measure the heart function or the heart pumping function in something called percentage, or in what we call a left ventricular ejection fraction, or LVEF, in percentage. A normal person who doesn't have any heart problem, usually their percentage is between 60 to 70. Once the heart function drop, the percentage drop anything less than 40, for example, then this is a time we will call them heart failure.
As a medical professional, Dr. Yong was used to being the one running tests for patients and delivering the diagnosis. But suddenly, the tables were turned.
I think it was a new experience. It's one thing to know it and another thing to go through it. I think there were pros and cons to the situation. The pros was that a lot of the procedures that they wanted to do, I readily agreed. Mainly because I understood why it was important, and for me, because I've also seen similar patients, so for me it was very part and parcel of how it should happen anyhow, and I think that made things go through quite easily. But partly because I guess it's also not my field of training, there were a lot of procedures which took me by surprise. Like, for example, there was one day they had to do an MRI cardiac, so it's like a special scan for my heart. And they needed to do a stressor test on me as well. So I have seen patients go through MRI, but they usually don't take so long. And I myself, I think it was 2.5 hours in the little machine. No, the machine is not small. There's the space where you're lying in is small. So that was about 2.5 hours inside. And I think at the 2.5 hour mark, close to the end, I was really antsy already. I keep calling out and asking whether it was going to end, because I just felt like I couldn't take it any longer. As a matter of fact, I think my sugar levels also had dropped at that time. So quite embarrassingly, when I came out of the MRI, I was like crying profusely, and the radiographer was like, oh, what happened? So I think it was good in one ways that I knew what was happening, but it's really a new, different experience going through it instead of just knowing about it.
After the break, how Dr. Yong navigated his path following his diagnosis. This is NCD Chronicles, our series that goes behind the diagnosis of non-communicable diseases. Stay tuned to Health and Living, BFM 89.9.
G'day, mate. Are you looking for
About seeing another person's life and trying to do something for them. For me, particularly in my field, what draws me is when we are trying to help a patient that nobody else wants to help. Like, there are a lot of people that by the time you get this particular diagnosis, or you're treating a patient and people say, okay, this is the end, there's no hope, or this patient shouldn't be receiving treatment. And I don't mean to give false hope to my patients as well, but I always have a soft spot to help the people that nobody else wants to help. Even if we cannot treat a patient, I believe in dignity and comfort to the patient. At the very least, we must be able to offer that to them. So that has been my driving force to remain in this career.
Hello and welcome back to Health and Living with me, T. Xiao Ik, on another episode of NCD Chronicles. Hope, dignity, comfort. The things that Dr. Yong Dae Jun tries to give to his patients are what he received in return when he went through a diagnosis of heart failure.
I think I owe a lot to the cardiologist who treated me. I think when I first got diagnosed, I was in extreme denial. Because I still remember I was telling her, you know what, just give me a day or two off. I'll be back to training tomorrow. Maybe I'll take an extra 1-2 days off on my own. Then I'll continue working. And I think she quite humorously just nodded her head and said, sure. And I think after the first week of admission, she kind of had to sit me down and like, this isn't what's going to happen. It's going to be a long, long journey, and it's not going to be a simple one. So I think finally, when it finally settled in my mind that I'm really having this, then began the depressive part of the diagnosis, where I start to wonder why me and what's this going to mean to me, both in my life as well as my career. And it was a process. It was quite some time to be able to get out of that dark place.
Even after he was discharged, Dr. Yong had to stay home for 3 months to recover before he was able to resume work, and even longer before he could function at work as he used to.
I think for me, initially, of course, going back was the greatest joy ever to be able to finally leave the hospital. Despite the fact that I work there all the time, it was really good to like walk outdoors and like, this is how it feels like to walk out the door and don't look back. But I think when I reached home, things got a little bit difficult again at first. So one of the things is that I have fluid restrictions, so I can only drink 1 liter of fluid per day. And when you're sitting in the hospital, being monitored all the time, it's quite easy to follow that. But when you're at home, naturally you want to do things. You want to do things, and with our Malaysian veteran to add on to that, it was quite hard to adhere to that. At the same time, I was told things like I needed to exercise, walk more. But at the same time, I'm so short of breath that even a simple walk was difficult. And I think it hit hard because I used to walk around the housing area, and I used to be able to keep up with my dad. The first few times I went, I was like, you know what, Dad, you just keep walking on ahead. I'll be somewhere behind here. You just remember to pick me up when you come back. That's all. So the first few times it was quite hard, and I never realized how much more weaker I was at that time until I actually came out of the hospital.
So the impact of heart failure to the patient's life, so I usually divide them into the physical part of it and the mental part of it. Because the heart is not functioning, so they will actually become breathless easier. For example, maybe 6 or 7 months ago, before they develop the heart failure, they are able to walk without any problem. They may be able to walk up to staircase, say to 2nd floor, without stopping or trying to catch a breath. But once the patient actually develop heart failure, maybe 10 steps in the staircase already make them feel breathless and they have to stop. They may need to stop 3 to 4 times before they can reach the malls or the market, which is different from before. And for example, in the middle of the night, when they're sleeping, they may actually wake up in the middle of the night because they try to catch their breath because there's now too many water inside the lungs, make them as if they're suffocating in sleep. So of course, this symptom is very scary. And this symptom will definitely sort of make them feel very concerned and very worried. I think most of the patients will say, I'm just not as good, I'm just not as fit, I'm just not sleeping well just as before. So this is mainly the physical part of things. And additionally, because of heart failure, they tend to get more and more water retention in the lungs, so they tend to get hospital admission in and out. In fact, some of them may actually come into the hospital because of water retention of water inside the lungs, maybe every couple of weeks, which we actually have seen them. So if you imagine that in a patient, especially in a younger patient who actually have a career in front of them, so of course they will feel very, very affected. And maybe they may actually feel depressed, and they actually look at the whole situation and outlook of their life in a different way. Because nowadays, even going up a staircase is actually problematic. How am I going to advance in my career? And one thing I want to stress is that heart failure is actually not a good thing to have. In fact, studies have shown that heart failure, the outlook, the chance of them dying is actually higher than compared with cancer. For example, if you have a lady with breast cancer versus a lady with heart failure, the chance of dying from heart failure in this lady is actually much higher than the lady with the breast cancer. So when you take all these statistics into account, coming back at the personal level, of course, the patient will definitely have a different outlook at looking at their life and looking at their physical symptoms.
That was one of the biggest struggles for Dr. Yong amid coping with his physical limitations. With a dark cloud hanging over his career prospects, he wondered whether he could continue to pursue his specialization, which would require rigorous physical and mental effort. There were naysayers who whispered doubts into his ear.
I guess for me, what happened was that initially, again, with the well-meaning people who advised me to perhaps quit or start reconsidering my options, of course, not all of them are well-meaning people. This is, I think, it happens everywhere. I mean, it's something you can't avoid anyhow. There will always be people like that. So I actually made a list of the things that I will never be able to do or the things that I should be considering to give up. And I think somewhere along the line, I decided that instead of listing the things that I can't do, it'd be better to list the things that I can do. Of course, the options are much less than it will be for another healthy person. But by focusing on what I can do instead of what I can't do, then life just keeps on going. I would say in many ways, looking back, in a way I've been given a second chance. Things went very relatively well for me. I think I'm very, very blessed that the treatment had gone quite well despite the initial hiccups. So I think for me, that's how it should be. You can't change what happened, but I can always choose what I want to do in the future.
Following your prescribed treatment can take you quite far in what you want to achieve at work, right?
Oh, for sure. I think because I think when I first came out and with my severe limitations at then, I was really telling myself that, this cardiologist just pulled a fast one on me. He's probably bluffing when he said he'll pull me through my training. There's no way I can get through this. And he was seeing me quite frequently. So we were adjusting medication and he was giving encouragement. And I think by the time I went back to work, I was like, okay, maybe it's not that far-fetched anymore. And now, about 2 years down the line, still there are restrictions, but I'm beginning to feel that there is a hope for tomorrow. That he wasn't really just patting me on the head to calm me down. It's definitely palpable. It's a very palpable difference.
This is the hope that heart failure therapies can bring to patients.
We need to understand that heart failure doesn't really have a cure because your heart muscle already damaged. So look at it as a lifelong disease, just like how we look at hyperpressure, just like how we look at diabetes. It's going to be a lifelong, and in medical terms, going to be a chronic disease. The good thing is we actually have a lot of advances recently, looking at medication, looking at different devices that will actually sort of improve the outcome. Over the past 20 years or so, we actually start to have a lot of medication that actually have changed the trajectory of this group of patients. The chances of dying has been reduced. The chances of getting hospital admission for heart failure also has been drastically reduced. So nowadays, we actually have what we call 4 groups of medication in our management of heart failure. So we have something called renal angiotensin inhibitor. We also have something called beta blocker. And nowadays, we have something called SGLT2 inhibitors and also something called mineralocorticoid antagonists. So these 4 groups now become the mainstay of medication for us to treat heart failure, regardless what's the cause, whether you are caused by some viral attack before or heart attack before. These 4 medication, if we actually put on board on this patient, the outlook have changed. Not just an outlook. In fact, they feel much better.
Dr. Yong is now a pill popper, but these medications are what keep him alive.
So medically, I am very fortunate. I'm still on follow-up and I'm taking medication for my heart failure. Some of the medications are common drugs, but because of my condition, so some of them are not so common. It's like taking candies every day, morning and night. In total, it's 6, but actually it's 5 types because one is taken twice a day. One of them is actually for cholesterol. I have one for my heart, that's the beta blockers. The rest are quite specifically for heart failure. And then I have a fluid restriction. I can only take 1 liter of fluid per day. And on top of that, I actually am on a CPAP machine at night for sleeping. That's to help me breathe.
Not forgetting, I think the other part is important is the patient himself or herself. I think they also need to take an effort on themselves, because lifestyle modification is actually also one part or important part in heart failure management. They need to take care of their water intake, because the heart is not functioning well. You take too much water, definitely you have more water retention. They need to cut down on their salt, because salt will attract water into the body, so they will actually end up with more water retention. They still need to exercise. I know it's difficult because you're breathless, but sometimes with medication, once you're less breathless, you should start exercising, because exercising, the heart will actually improve. The muscle that is still alive will actually come in and actually support the part that was the heart muscle that is already dead. So these are the things that the patient still can do. Take care of the diet, more exercise. These are the things that will actually improve the outcome.
So these restrictions are real. And because I'm in a surgical-based training, it does hamper me from staying in long surgeries. I usually will have to have a partner with me in OT, because I will need to have breaks in between. Of course, this will ultimately affect my training and my overall experience and skills. And I think that has what has been brought about some well-meaning people of advising me to sort of give up and quit. But at this point, I guess I don't want to quit. If I reach the point where it really doesn't work anymore, then at least I can say I've tried. And I feel that for me, that's the very least. I want to give it all, give it my very best. If it doesn't work out, sometimes that's just how life is, but not because I quit.
In fact, many people on proper treatment for heart failure not only have a chance to persevere in life, but go on to defy all expectations. And even those who have poor ejection fraction may actually experience remarkable improvements in their heart function.
So the ejection fraction, the percentage that we have mentioned, is just for us to use it to actually diagnose or confirm that this patient have heart failure. And once we actually have confirmed that this patient actually have heart failure, then they should be on 4 medication. Sometimes when you repeat the ultrasound or echosonography, the patient ejection fraction, the percentage may not actually have improved, but their symptom level and their effort tolerance usually improve. Just to give you an example, I actually have a young Indian chap who actually have a heart attack, and his ejection fraction was like 30%. So with medication, his ejection percentage is still somewhere about 35 to 40, but he is able to go to base camp nearly every 2 years.
I'm assuming you're talking about like Kinabalu.
Everest.
Oh, wow.
Yeah, exactly. I have not been, and yet the patient has been there every couple of years.
I think most typical people without a heart condition can't
exactly.
do that.
So that percentage sometimes does not really mean that you will be breathless, you cannot do this, you cannot do that. We just use a percentage to actually guide us that, look, this is a heart failure, look, this is the medication that this patient should be on. Whether they will improve the ejection fraction or not, we don't really look into it. And the symptoms improvement sometimes is actually not related to the ejection fraction improvement.
Professor Chee adds that studies have shown when patients take all 4 types of medications, their outlook and improvement of symptoms are actually better compared to patients who only take 1 or 2 types of medications. And fortunately, all 4 types of these treatments are also available and accessible in public health facilities in Malaysia. For a patient like Dr. Yong, there will be no choice but to continue taking his 6 pills daily for the rest of his life.
A lot of my patients actually ask me, Doctor, now I have improved. I'm used to be coming to the hospital for admission every couple of weeks. Now I hardly come to hospital for 6 months. Now I actually can walk further. I can go to masjid within just 1 walk without stopping. Can I cut down my medication? For various reasons, for example, the cost, too many pills, for example. But we actually have looked into this, and we actually have seen a study that sort of what we call divide the patient into two groups. One group, they continue just as it is. The other group, we slowly cut down the medication. And on that group, when we actually slowly cut down the medication, they actually end up with more problem. They end up, the moment you cut down medication, they start coming into the hospital again. They start to have leg swelling again. So I think that is the reason why we usually do not advise the patient to actually stop the medication or even reduce the dose of the medication, unless, of course, they face side effect from the medication. But most of these are actually quite well tolerated. I do see in my patient where after a while, they become sort of lost sight of their illnesses because they felt that because now they feel less breathless, they hardly come to the hospital now. So they thought they may actually has cure in a certain way. So as in every human, they will definitely try to cut down the medication, do less and all that. But unfortunately, in heart failure, you will actually feel the sequelae straight away because unlike your, for example, high blood sugar, you may not feel the high blood sugar. But the moment you cut down the medication with heart failure, the patient will feel it quickly because they will start to have water retention, their leg will swell up again. So they feel it the moment they're taking less care of themselves.
Of course, a lot of things are easier said than done. And even the health professionals themselves often have no idea what kind of commitment is needed from patients to adhere to medical advice.
It's always easier to say and a lot harder to do. So I will say I hope I was a good patient to my doctors, but I'm sure I was just as notoriously defiant as most of my patients are to me as well. I was being naughty myself in a lot of secret ways. Sometimes the simple things that look so simple before this is very different. Like for example, this restriction of fluid. I used to see so many patients who had to have restriction of fluid, and I keep telling them, uncle, cannot. You must follow. It's so important for your safety and for your heart and your lungs that you follow the fluid restriction. And I myself oh my gosh, today instead of 1 liter, I got 1.1 liter or 1.2 liter. I'm like, oh, never mind, just close eyes, don't think of the extra. And I'm like, oh, actually it's how important it is. It's still hard to push aside your own desires.
Despite the ups and downs, the Dr. Yong of today is a vast improvement from where he was 2 years ago.
So I think firstly, my energy has much been improved. I'm able to go back to work. I'm able to do rounds and walk. Of course, I'm the slowest person walking, but at least I'm able to do all those. And even though I get very lethargic by night, at least by most of the hours of the day, I'm still able to function well. I do get very short of breath. But otherwise, generally, I think it's because I'm able to do a lot of the things that I would need minimally to run through a day, what we call activities of daily living, without having to think so hard or plan my lifestyle around it. So I think in that sense, it's been good.
From the medical standpoint, Professor Chee is equally pragmatic about a future with heart failure.
So if you are recently diagnosed to have heart failure, all right, first thing first is find out whether there's anything the cardiologist or the doctor can do to reverse the cause of the heart failure. In some situations, for example, if the patient actually have a valve problem, by going through a valve surgery, then the heart failure in a way can be reversed. But in most cases that I have seen, the heart failure unfortunately cannot be reversed because the cause of the heart failure may be a couple of years ago or the virus has already died inside, so you cannot reverse the time course. The good news is that over the past 20 years, we actually have new medication, right, to actually treat the patient. The patient will definitely feel better. The chances of them coming to the hospital again and again for fluid retention or water overload has been reduced. In fact, their lifespan actually improved. The chances of dying with medication actually have improved over the past couple of years. So this is definitely good news. The patient will feel better. The patient have less chance to actually die from the heart failure. So with that, the patient's outlook of their future is definitely much brighter now compared with, say, 20 years ago. And they will definitely feel better. For example, the patient now can actually walk better. They don't wake up in the middle of the night, for example. But in the long run, the patients still need to really take care of themselves. For example, don't have further damage to their heart. I mean, if you don't take care of the risk factor like diabetes, you will get more heart attack, for example, of course, you will lose more heart muscle and your condition will get worse. So they definitely need to play a very active role in making sure that the disease does not progress by make sure that they're compliant to the medication, make sure they do enough lifestyle modification and preventing further damage to the heart. Some of the patients actually can continue to lead a very good life. They can be like a mother and take care of the house again. Some of them may go back to athletic activity, they're involved in sport, traveling and all that. So definitely nowadays is much better.
I asked Dr. Yong what his future looks like. When we speak again in 20, maybe 30 years, how would you want to introduce yourself?
I'm Yong Dijun. I've lived my life. I've done the things that I wanted to do and done the things that I could do, and I didn't give up. The message I really want to get through is that it's not the end. The tunnel will look bleak, the road is uphill, a lot of the pathways are closed. But most importantly, there's still a path to walk. There's still things that you can do, and despite limitations, I think this is what we should focus on. And I think as long as we keep doing the things that we can do within our limitations, in more ways than one, we are living the life. So I hope that it gives a sense of hope, because I too went through that dark times and I thought that this is the end. And I hope they'll realize that this is not the end. The sun will rise tomorrow and it'll be another day to do more things than you did the day before.
This has been NCD Chronicles, a series featuring the experiences and challenges of people with non-communicable diseases. This episode was brought to you by Novartis Malaysia, reimagining medicine to help improve and extend lives of over 32 million Malaysians. If you missed any part of the show or previous episodes, you can listen to it on bfm.my or on our BFM app. You've been listening to Health and Living, BFM 89.9.
This is the first time different